You're watching EAC News. Thanks for joining us. Almost 3 times as many people have died as a result of COVID-19 as official data show, according to a new World Health Organization report, the most comprehensive look at the true global toll of the pandemic so far.
There were 14.9 million excess deaths associated with COVID-19 by the end of 2021, the UN body said on Thursday, 5th of May. The official count of deaths directly attributed to COVID-19 and reported to WHO in this period, from January 2020 to the end of December 2021, is slightly more than 5.4 million. The WHO's excess mortality figures reflected people who died of COVID-19 as well as those who died as an instant result of an outbreak, including people who could not access healthcare for other conditions when symptoms were overwhelming during the huge waves of the infection. It also accounts for deaths averted during the pandemic, for example, because of lower risk in traffic accidents during lockdowns. But the numbers are also far higher than the official tally because of the deaths that were missed in countries without adequate reporting. Even pre-pandemic, around the 6 to 10 deaths around the world were not registered, WHO said. The WHO report said that almost half of the deaths that until now had been counted were in India. The report suggests that 4.7 million people died there as a result of the pandemic, mainly during the huge surge in May and June 2021. The Indian government, however, puts its death toll in January 2020, December 2021, the period of lower, about 480,000. WHO said it had not yet fully examined the new data provided this week by India, which has pushed back against the WHO estimates and issued its own mortality figures for all cases of death in 2020 on Tuesday. WHO said it may be a disclaimer to report highlighting the ongoing conversation with India. In a statement issued after numbers were published, the Indian government said WHO had released a report without adequately addressing Indians' concerns over what is called questionable methods. The WHO panel, made up international experts who have been working on the data for months, used a combination of national and local information, as well as statistics models, to estimate totals where data is incomplete, a methodology that India has criticised. However, other independent assessments have also put the death toll in India far higher than the official government tally, including a report published in Science which suggests that 3 million people may have died of COVID in the country. Other models have also reached similar conclusions about the global death toll being far higher than the recorded statistics. For comparison, around 50 million people have thought to have died with the 1918 Spanish flu pandemic, and 36 million have died of the HIV since the epidemic began in the 1980s. Samara Asma, WHO Assistant Director General for Data, Analytics and Delivery for Impact, who co-led the calculation process, said data was that lively blood of public health, needed to access and learn from what happened during the pandemic.
Too much is unknown and there is too much delays in getting life and death information.